Welcome back. Just after 7:15 here on this Wednesday morning, a local scientist says the country's health system will be under severe pressure if the anticipated third wave of COVID-19 infections coincides with winter respiratory viruses like the flu. Marc Mendelson, a professor of infectious diseases at the Groote Schuur Hospital and the University of Cape Town, says it is important for South Africans to take the flu vaccine. Mendelson says with the country on level 1 of the lockdown, return to schools and general poor compliance with public health protection measures means SARS-CoV-2 might be joined by the flu as winter approaches. Professor Mendelson joins us now to elaborate a bit more on this. Prof, thanks for being with us and good to see you this morning.
A pleasure and good morning to everybody.
All right, so please elaborate on your notion that it would be a double whammy if this third wave of COVID-19 coincides with a seasonal flu over the winter period.
So South Africa, like all temperate countries, suffers from seasonal influenza epidemics. Generally, that occurs around between May and August, although it can start as early as April or as late as July and lasts for around 3 months or a little bit more. And last year, we actually saw the beginning of an influenza epidemic in the Western Cape in mid to late February, March, and then lockdown happened, school closures, etc. And basically, transmission routes were just cut off. So we and other countries in the world really didn't see a very marked influenza seasonal epidemic last year. But we don't know what's going to happen this year. Influenza, like SARS-CoV-2, is highly unpredictable, and it's fertile ground at present because as we go back, the schools go back. We know influenza is transmitted a lot through in the school children. Perhaps there's a relaxation slightly of people's adherence to the public health interventions that we need to maintain. There are indoor gatherings starting to be allowed, and winter approaches. And again, we don't know whether there's going to be a third wave of COVID. We don't know when it's going to be. Yeah. But a double whammy of influenza and COVID would put an extra strain on the healthcare system. And I think at this time we need to be very cognizant of all the prevention measures we could take to try and prevent that scenario.
Yeah, and that is a reality, as we say. I mean, a lot of people saying last year, I didn't have the flu. We didn't see it, but I suppose we were all at home, and that perhaps is one of the reasons behind that. But this is a very different scenario this year. Life has all but resumed. I mean, there's very few things that we're not doing, and I mean, I've already noticed, particularly where you talk about schools, and I can already see some of the kids starting to get sick and get the sniffles and get the coughs and the sore throats, and it's not necessarily COVID, but it is the flu. One thing you are saying and advocating for is the fact that we should get that flu vaccine again. Now, talk to us about this, and it's always an issue of availability.
No, thank you. I'm sorry, I lost you for a while there. So, look, just to clear one other point up. There are many different types of respiratory viruses, and unfortunately, those circulate in the winter months. And influenza, which is a virus which is one of the causes and one of the most serious causes. So what can we do to prevent it? Obviously, the public health measures that we know, but vaccination also is important. Now, vaccination for influenza is really targeted at people who are at high risk of getting severe influenza. And those people are in specific categories and risk groups. So each year there's a prioritization approach taken, and if one goes to the National Institute for Communicable Diseases, the NICD website, the full list can be seen, or at the Department of Health. But the priority groups are pregnant women who have particularly severe influenza pneumonia, if influenza occurs, people with immune suppression, so our HIV population, those with chronic diseases, particularly chronic lung diseases, because again, an influenza infection in the lung could give a second hit to people with lung disease, and then other chronic illnesses, people with diabetes and morbid obesity, and a number of other factors, including age. So over 65 years is a risk factor as well for severe influenza. So it's really those people that need to think very carefully and try and get vaccinated. Many people will already be vaccinated. And unfortunately with influenza, the vaccine is a yearly vaccine. Because the influenza virus, from year to year has subtle changes, we need to keep up. And each year there's an exercise where the World Health Organization looks at the strains of influenza that have been circulating in the previous year and designs the vaccine for this year. So it's really those risk groups that we need to be very careful, I think, and I would really recommend that anybody in a high-risk group for influenza tries to be vaccinated.
Yeah, it's amazing how the narrative sounds so similar to that of COVID, and yet it's not. But the flu is still a big killer. I mean, some of the numbers we talk about is approximately 10,000 people die annually from the flu in South Africa. However, when we look at this flu vaccine that we're talking about, I had mentioned, and I think we that was where you broke the connection a little bit in terms of the fact that South Africa doesn't receive a lot of these vaccines. I mean, we receive, the number I have in front of me, and I need you to confirm it, fewer than 1 million vaccines annually. Is that correct? If so, why are we not procuring more of these flu vaccines?
So that's right. In the public sector, we procure around between 800,000 and 1 million doses per year. And if you do the maths, obviously the risk groups, just the risk groups that I've listed would be run into over 10 million people who would require vaccination. I mean, the procurement issue is a problem because with all health resources, one has to balance procurement. I mean, influenza vaccination isn't the only demand on the health system budget, and obviously it's a very difficult balancing act to make. Unfortunately, despite only having around 1 million doses of vaccine procured, there are years where some vaccine doses go unused. And I mean, that ties into some of the same issues that we're seeing with COVID in terms of vaccine hesitancy. But also, I think there's an underappreciation of the importance of influenza vaccination to control seasonal epidemics. And as you say, around 10,000 people over the age of 5 in South Africa each year will die of influenza. Now that's small compared to what we've seen in COVID-19 over the past year, but it's an appreciable number and a loss. Influenza is a vaccine preventable disease, but the balancing of health budgets and resources and what one procures is often a difficult issue, which needs to be thought about, particularly in this.
It certainly is going to be
now find ourselves.
It's going to be a big balancing act because obviously we're still talking about the whole procurement of a vaccine for COVID-19 and we're still lagging on that. And that's a huge expense that the country needs to undertake. And then there's still the vaccine. But what you're saying is we need to have this flu vaccine, and hopefully we will also get a COVID vaccine very, very shortly that a lot of us will be able to take. I mean, are you optimistic about this? What are your views on this rollout in terms of the vaccine?
Again, I'm really sorry you cut out a little bit there, but my understanding is you're asking about the rollout of COVID-19 vaccine now. So I mean, look, incredibly welcome that the program has got off to a start, and the healthcare workers are being vaccinated. Again, there's procurement. We've been slightly slow in procuring a vaccine. There are a number of schools of thought around this, but the importance now is to really try and accelerate our vaccine rollout, because the importance is to try and build up the number of people who have immunity from vaccine and the number of people who have immunity from natural infection. And until we get to much, much higher levels than we would see currently, the possibility of a third wave is almost certain. What that's going to look like, we don't know. But unfortunately, that's the issue we have at the moment.
Yeah. All right. Dr. Mendelson, thanks very, very much for talking to us here on the program. And this is, of course, a real issue that we need to take heed of. I'm glad we addressed it. Professor Marc Mendelson talking to us about why it is still important to get that seasonal flu shot amidst this pandemic. Also, just talking about that double whammy of still going into winter, having to deal with COVID-19 and a flu strain. So that's something we really need to take into our hearts right now. All right, let's quickly take a